Gallbladder cancer, symptoms and treatment. Gallbladder cancer is a rare form of cancer that starts in the inner tissue of the gallbladder. Some people may not notice any symptoms in the early stages. This means gallbladder cancer is often hard to detect early, as doctors often do not discover it until a person develops symptoms in the later stages. This video reviews gallbladder cancer symptoms, risk factors and more. What is gallbladder cancer? Gallbladder cancer is a rare form of cancer that starts in the inner layers of gallbladder tissue. The gallbladder is a small organ located under the liver in the upper part of the abdomen. It is responsible for storing bile that the liver produces to help break down fat during digestion. Though the gallbladder can aid digestion, a person does not need it to live. This means a doctor can safely remove it from the body and a person can live a normal lifespan. Symptoms. Gallbladder cancer does not always cause symptoms in early, easily treatable stages. They often appear in more advanced stages when the cancer has spread. When they do occur, symptoms may include abdominal pain, nausea and vomiting, abdominal lumps, jaundice. Less common symptoms can include fever, abdominal swelling, weight loss, dark urine, light-colored or greasy stools, loss of appetite, itchy skin. Types. A person may develop one of the several different types of gallbladder cancer. The cells in which the cancer starts determine the type of cancer. About 90% of all cases start in the gland-like cells that line the inside of the gallbladder. Doctors call this type adenocarcinoma. Here are 3 examples of adenocarcinoma subtypes. Non-papillary adenocarcinoma, the most common subtype. Papillary adenocarcinoma, less common than non-papillary. This type is unlikely to spread to the lymph nodes or liver and has the best outlook. Mucinous adenocarcinoma, the rarest subtype that starts in the cells that produce mucin, an ingredient in mucus. Less common types of gallbladder cancer include squamous cell carcinoma, carcinosarcoma, adenosquamous carcinoma. Causes. The exact causes of gallbladder cancer are still unknown. According to the American Cancer Society, chronic gallbladder inflammation may be to blame. Gallbladder inflammation can result from gallstones. This may cause the gallbladder to release bile more slowly, exposing the cells to the chemicals in bile for longer than usual, causing irritation. Gallbladder inflammation can also result from abnormalities in the ducts that take fluids from the gallbladder and pancreas to the small intestine. These defects can also allow pancreatic juice to flow back into the gallbladder, causing irritation. Chronic inflammation in the gallbladder may also contribute to changes in cell DNA. Mutations in cell DNA are a cause of cancerous tumors. Complications. Even with successful treatment, gallbladder cancer can return. If a tumor returns, it may cause abdominal pain, obstructive jaundice caused by blocked bile ducts, unexplained weight loss. Risk factors. Some factors increase a person's chances of developing gallbladder cancer. Some known risk factors for the cancer include gallstones, porcelain gallbladder, a condition where calcium deposits cover the organ, obesity, older age, choledochal cyst, which are bile-filled sacs, gallbladder polyps, abnormalities in the bile ducts, typhoid infection, family history, primary sclerosing cholangitis, an inflammatory condition that causes scar tissue. Other possible factors include smoking and exposure to certain chemicals. The connection between these factors is not as clear as some other risk factors. Diagnosis. When a person visits their doctor due to symptoms, their doctor will likely discuss the person's symptoms and medical history. They will likely perform a physical examination. If the doctor suspects gallbladder cancer, they will likely recommend different tests to help determine if cancer is present. Tests will likely include blood tests to look for tumor markers, liver function test, CT scan, ultrasound scan, biopsy, laparoscopy, endoscopic ultrasound, MRI scan. Prevention. A person cannot directly prevent most types of gallbladder cancer. Many risk factors come from aspects a person cannot change, such as age or ethnicity. However, a person can take some steps that may reduce their risk, such as eating a healthy, balanced diet, exercising regularly, maintaining a healthy weight, quitting smoking, avoiding alcohol. Treatment. Doctors have a few different methods to help treat and potentially cure gallbladder cancer. Surgery offers the highest chance of successful treatment of gallbladder cancer. A doctor may recommend a radical cholecystectomy if the cancer has not spread past the gallbladder. In this procedure, a surgeon removes the entire gallbladder, surrounding lymph nodes, and some of the surrounding tissue. If the cancer has spread beyond the gallbladder, they may increase how much tissue they take. Other treatment options are available if surgery is unsuccessful or not recommended. They may include chemotherapy, radiation therapy, blockage removal to relieve symptoms.